Hello everyone, I hope you all are doing good. Welcome back to Module 8 Motivation, Crisis and First Aid for Mental Health. Now we are commencing Lecture 5 of this module. Before we get started, I would like to introduce myself. I am Akanksha Avasthi, a mental health expert and RCA registered clinical psychologist. I have been working here at Institute Counseling Service of IITK for past several years. Today's lecture is all about addressing the burnout in academic and professional work settings. We have heard this term multiple times. Now it's time to understand its whole dynamics, how it works on the individual, what are the causal factors behind it, and what are the strategies which we can use to deal with it. Topics to be covered: the basic introduction of all these points, recognizing symptoms of burnout and its impact on mental health, techniques to prevent and recover from burnout, fostering a supportive environment to reduce stress and exhaustion. So basically what burnout is. Burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. This is the definition given by WHO in 2019. The similar conditions can be prevail in the academic settings as well. So burnout can be in the academic settings as well as in the workplace. So basically when someone is going through the burnout, what is happening in his emotional state, physical state and in his motivation? The person usually feel too much exhausted physically. The person is least motivated. He wants to work but he is not having the kind of motivation he used to have earlier, and also there is a certain kind of emotional distancing from people who are closely related to the person. Burnout is not just being tired, it's a chronic psychological response to prolonged stress, especially in high demand environments like academia and workplace. And there are three trademark symptoms. The first one is emotional exhaustion, depersonalization, and reduced accomplishment. So, in the exhaustion phase, when the person is emotionally exhausted, he doesn't have energy to invest into emotions. They usually distance themselves from the close one people, their teachers, their friends, their parents, their colleagues. The second thing is they have a reduced sense of accomplishment. They think that they are not done enough. The third thing is a sense of depersonalization. These are the contexts that raise the risk of burnout. So if you are having insufficient self-care, you're not sleeping properly, you are too much overwhelmed, there are causes which lead to exhaustion and later on to the burnout. There is a toxic workplace. The individual is not getting proper praise, proper reward for their accomplishment. So this toxic kind of workplace also leads to burnout. The third thing is life loss. If there is some death or some kind of life loss in the family, that can also be a causal factor. Significant rejection. The person is getting a very significant rejection from workplace, in the personal life or in the academia. They can't tolerate it many times and it can also lead to burnout. Also, if there will be comparison with the peers, with the colleagues, these all factors combinedly lead to burnout. The 4 hours negative cycle. So basically how it starts, I'll describe it. The very first thing is the person think that he is not doing enough. He is not getting the proper recognition in his workplace. So he start putting more energy into the work. They start taking less breaks. They invest too much into the work, and what it leads? It leads to the exhaustion. Then what happens? Because of exhaustion, because of incomplete rest, not getting proper sleep, your efficacy of the work get decreased. This is the second step. The third step is when we rest less, we recover less, our efficacy also falls, and then our regulation and reward falls more, and we go into the loop of cynicism. So if all 1 to 4 steps get repeated, gradually it leads to the burnout. So burnout doesn't happen in one day. It is a chronic thing. It's a response of body and mind to a chronic stress. When person stays in a chronic stress for a longer period of time, this is the result. There are 8 burnout myths which I want to explore with all of you, because usually we think these are the facts, but basically it's not true. It's not a one time thing. If a person once a victim of burnout, it doesn't mean that later on also he'll never go into that loop. The person can be again and again be a victim of burnout because it's not a one time thing. The second thing is, it's only lasts for few days or weeks. No, it can go on for weeks, months, and even years. And it very passively it affects your mind and your body. It's a mental issue. No, burnout is not a mental issue. It's a body and mind's response to a particular stressful and chronic life settings. It's only caused by workload. No, as we will proceed later on in the lecture, you will realize that there are multiple causal factors which are leading to the burnout. It's not only workload. Sometimes people very willingly they take the workload and they do it and they accomplish good. But sometimes if it is enforced, there is no proper recognition, there is no proper breaks, rest in between, no self-care. Combinedly, it leads to burnout. So it's not only the overload which is leading to the burnout. I can't burn out if I love what I do. This is some notion which is very prevalent in the sports person, in the field of academia and the workplace. When you join some institute, even though you join PhD, you are loving your research work, you want to do it. But the point is that you can't neglect other things in your life in just view of that particular work. Your self care, your emotions, your recreation, your family, rest, everything combinedly is required to have a very good mental health. So you can't only focus on your work life, and if you're loving it too much and you are spending too much of time, sometimes it is helpful when deadline is really close. If you are making it a habit and you are genuinely and chronically neglecting your mental health, your rest, your family, your emotions, then it can lead to burnout. Sometimes we feel like we are a defective piece. We are the one who is suffering from all these issues. There are other people who are accomplishing more. They are spending more time in workplace, but despite that, their work-life balance is very good. It's not true. Sometimes, although we are having very good resilience, we are good in the time management, sometimes because of certain factors, we get too much involved into work or academia, and this can also lead to burnout. So you're not a damaged piece if you are doing and you are going through this difficult phase. High performancers are immune. It's also not true. The people who are accomplishing very good on the topmost level of the organization or academia, they can also suffer with these kind of things. This happens with them also. Sometimes they are able to deal with it because they have a very good support system, and sometimes they are also able to do it because they have a counseling service help, they have friends which can take care of, they have good time management resilience, but they are also not immune to the burnout. They can also go through this. Changing my job or taking time off will resolve it. No, that's also not true. If you are changing your job and you're not changing the pattern with whom you are processing, you are working, you will again go into that burnout phase in the next job as well, or in the next institution as well. So what it needs to, it requires to have a cognitive change, how you have to work, how to take proper rest, how to prioritize yourself, how to be assertive, and how to focus on your mental health as well as your work. So just taking time off also doesn't help if you come back to the same settings after the vacation or after the time off. So these are the basic signs of burnout which I have already discussed: emotional exhaustion, depersonalization, reduced personal accomplishment, and mental and physical health impacts. So first we will come to the emotional exhaustion. The person feels that he is continuously tired, he is emotionally exhausted. Despite waking up in the morning after taking rest, they continuously feel a sense of tiredness. They feel emotionally exhausted. They don't have emotional energy left to deal with other relationships, with their family time. So, this emotional exhaustion is continuous and pervasive things when you are in the starting phase of burnout. You have the irritability, you get mood swings, you think that you have to push yourself for work, you have to push yourself to go into social settings. So this emotional exhaustion is a very primary component of burnout. Depersonalization and cynicism. Depersonalization, becoming distant, emotionally distant from your peers, colleagues, friends, teachers, and family. You become emotionally distant. So, gradually in the later slides, I'll explain why this happens, that we become emotionally distant and detached with our family. Cynicism is a negative or indifferent attitude towards work. Who cares about me? What if I won't come to office tomorrow? So they have this laid back attitude and a very negative and neutral kind of attitude towards work. It also comes as a part of burnout, because there's too much overload. The person feel like, I don't care for anyone. Sometimes they have a very indifferent tone towards colleagues, and they lack in the empathy or compassion also. So this is also one of the very primary signs of burnout. The third one is reduced personal accomplishment. What happens in this domain, the person continuously feel that he is incompetent. The student who is coming to a very top notch college, he realized that everyone is able to learn very easily. They are grasping things very fast, but I am the one who is not able to take the pressure easily. I am not able to understand the concepts easily. So then gradually he is having a sense of inferiority, that I am not the one who should be here. I don't deserve this place. I am not expert enough. I am not efficient enough to be in this place. Similarly, in the work settings, the employer is demanding more and more, and employee personally feels that I'm not the one who should be here, who deserve a raise, who deserve a bonus, who deserve a good upper. So this kind of lack of accomplishment and the sense of it comes to the person's mind when he is going into the phase of burnout. Now comes the mental and physical health impacts. So what happens, burnout doesn't only affect your physical health, it also affects your mental health. So what happens, your mental health is started because you're not taking proper sleep, you're not eating properly, you're not taking proper rest. So what is happening, you're becoming irritable, you're becoming angry, you are frustrated. Gradually it leads to bouts of anxiety, it can be depression, and later on it can lead to severe mental health crisis as well. Now come to the physical part. You have multiple physical symptoms like headaches, fever, continuous and repetitive illnesses. So these all things will come. You can see in the diagram here that chronic fatigue, insomnia, headaches, muscle pain, and multiple kind of gastrointestinal problems can also come. Your weakened immune system get weak, so that you get sick more often. It has been seen that in severe cases, it can lead to severe depression and cardiovascular diseases or substance abuse as well. Here I would like to tell you the difference between stress and burnout. These two are very similar terms, but they are not exactly same. The burnout is gradual onset with prolonged exposure to chronic stressors, and stress is often triggered by specific events. In the burnout, as I have already told you, emotional exhaustion, depersonalization, and reduced personal accomplishment is there, but stress is associated with feelings of overwhelm, anxiety, and pressure. So basically, burnout is work related demands or academics related demands, and there is a lack of fulfillment. But stress can stem from various other resources as well, like work, personal life, or external factors. So burnout affects all areas of life, while the stress affects the only immediate causal factors. Leads to sense of cynicism, detachment, and negative attitude. But stress can cause irritability, difficulty in sleep, and concentration. Burnout leads to motivation, loss of motivation, and decreased productivity. While in stress, what happens? Multiple physical factors like headaches, muscle tension, and fatigue is also there. In the burnout, people in the later stages require professional help, therapy, or sometimes they need to change the career or work environment. But stress can be managed through stress reduction techniques like self care and better coping strategies. Now, there are three interrelated yet different concepts which I'll again want to describe: burnout versus exhaustion versus depression. Usually, in our day to day life, we use all these terms interchangeably. We think that exhaustion, stress, burnout, and depression, they all are same. The person is depressed doesn't mean that he is going through the burnout. The person can be exhausted, but he cannot be stressed or depressed. So I'll again explore it. Depression may mood is elastic. Usually the person remains sad, but in burnout, mood is less elastic, and in exhaustion also, mood is more elastic. It means the person can be in depression, the person remains sad most of the time. Similarly, in the burnout also, the person is having low mood and sadness most of the time. But in exhaustion, the people can be happy as well. And whenever he gets proper rest, he can be euphoric. Now the rest comes. The rest doesn't bring any kind of relief in depression. Rest is having very good impact in exhaustion, but in the burnout, rest doesn't have much impact. Although it gives some relief, but it doesn't give too much relief. Basically, exhaustion is a totally physical thing. Depression is mostly a mental thing, but in the burnout, it is a combination of both physical and mental health issue. So, giving up, hopelessness for recovering, desire but confusion for recovering, confidence in recovering. These all the differences in the exhaustion, burnout and depression. So you can see the chart, and all four domains are slightly different in all three topics. Now comes to the science of academic burnout. When we specifically talk about the academic burnout, we divide it into four main parts. The first one is emotional science, physical science, cognitive science, and behavioral science. So all you can see is that there are emotional science, hopelessness, helplessness, detachment, increased anxiety, lack of motivation, exhaustion, feeling of inadequacy, heightened emotional reactivity. So when we come to the emotional symptoms, we know that person is facing lots of emotional kind of symptoms. When we come to the cognitive symptoms, we know that they are having different kind of cognitive inefficiency. They're not able to concentrate on the work given. They're not able, their attention and concentration level decrease. Their problem solving skills decrease. They're not able to take a decision at a very short notice of time. They become perplexed. In the physical form, what happens? They feel exhausted, chronic fatigue is there, their immune system gets weakened, so they will be ill most of the time. Many times in the semester, the student get frequent illness, mild fever, migraine, headaches, gastrointestinal issues. In the behavioral science, what we can see, they are procrastinating, they don't want to do the work, and they doesn't want to do the open communication about their problems. Now, when we are coming to the professional work settings, these are the signs. The person becomes highly sensitive towards any kind of remark given to him. The person also feel exhaustion. There is increased absence in the workplace. There is withdrawal and isolation, and there is increased mistake or accidents happens. So these all are the sign and symptoms of work settings, which are quite similar to the academic settings, but yet there are certain different things which happens in the workout in burnout in academic settings, and burnout in the work settings. Then causes of academic burnout. So we all know, first you go to this chart and see it. The prominent factors I have mentioned here. So now I am coming and explaining all these to you. So what happens when you go to college? You are having lots of hopes whenever it's a UG or PG or research program. So you think that you will work very dedicatedly and you come with the same gist, same zeal. What happens when you see that the expectations you are not meeting with the reality? This is the first setback. Sometimes your teacher, your institution is expecting too much from you, which is beyond your capacity. Second thing, sometimes despite giving your best, it's not enough. So you have high expectations, or people around you are very high expectations from you. Then you get the lack of satisfaction of what you are doing, and it leads to lack of appraisal and lack of reward. The third thing is sometimes you feel that you have to do everything in a very perfect manner, but which is not possible. So what happens? You again go into the loop of procrastination, and at the time of deadline you are not able to do the work in the way you want to do it, and then you become perplexed, and if this continues for a longer period of time, it leads to burnout. Sometimes there are financial crises as well. Because of that, it leads to academic burnout. Sometimes there are lack of autonomy. Sometimes you want to work, but you're not getting the desired freedom. There's very micro level of management is there, so it also leads to burnout in the academic settings. Now, as we see in the chart, that these are the causes of workplace burnout. So you can see there is lack of appreciation, there is poor time management, and also there is micro level of management which is not giving any kind of autonomy or any kind of freedom to the employee. Their deadlines are very strict, the management is not really caring towards the person. These all leads to, sometimes their work setting is also isolated. These all leads to the burnout in the workplace settings. You can go through the chart once again and see that these are the 5 primary components which leads to the causes of workplace burnout. Now, these are the 5 very prominent stages of burnout. In any case of burnout, individual goes through all these 5 phases. The very first phase is of honeymoon phase, when person think that he will do everything good. Despite seeing the toxic work environment around you, the person feels he will deliver his best. So in that phase, although there is physical and mental exertion, but the person is very high in the hopes and they want to work towards it. The second phase is onset of stress. So onset of stress means sometimes occasionally you feel that it is too much. You start feeling exhaustion, you start feeling the symptom of stress. So this is the second stage. The third stage is chronic stress. When this stress continues and you are having your, for example, you are having your lunches and dinners in the workplace, you're not getting proper sleep, despite you are taking break also in the rest time, you keep thinking that these things are going on in your mind. The fourth stage is of exhaustion, that now your body is telling you that what is going on and you come into the burnout stage. And the last stage is habitual burnout, when you feel that you are used to this condition and if you continue in the same condition, it will lead to the chronic burnout and mental health issues as well. So you can see here that burnout plays in all the 5 stages. In the first stage, there is compulsion to prove yourself. The second, you are neglecting your needs. The third one is you are denying that problems are emerging in your life. You are withdrawing. And the fourth stage of burnout, you see the depersonalization, inner emptiness, but still you continue. And later on, if you reach to the habitual burnout, then it leads to depression and multiple serious physical illness. So how it works? In our brain, there are proper 3 sections. The very first section is which is of higher mental functions. The second one which leads to emotional stage, and the third one is survival state. As you can see in the diagram, this is the first one, prefrontal cortex. The second one is our limbic system, and the third one is survival state. So what happens during the evolution, our brain evolve in a much better way than our body. So whenever you are going into the burnout, what happens? The brain's primary and higher executive functions, they just shut down and we start operating on the basic survival state. So we think that we have to prove ourselves in case we need reward. We don't think ki why the situation is going into that condition. You don't question that what I'm learning from this condition, but you start blaming yourself. I have to work for long hours to survive in this condition. Emotional state also get deteriorated, so that you start feeling like ki am I loved or not. So basically what happened, if you continuously stay in the burnout conditions, your higher executive functions and emotional functions, they just get shut down and you start primarily operating with the very basic preliminary mental setup which are leading to the survival state. And what happens, that's why it is very difficult to come out of burnout without getting the professional and therapeutic support and help. These are the techniques to prevent. The first techniques are preventive techniques like time management, healthy lifestyle, mindfulness, and the recovery techniques are time off, reassessing workload, and seeking professional helps. So in the time management, as we have already told you earlier, you have to set smart goals, you should avoid the multitasking, and you have to say no to the extra work, you have to be assertive. Because prevention starts with the good habits. If you start preventing things, it won't lead to the extreme exhaustion and later on to the burnout. Healthy lifestyle habits are these ones, and these are the mindfulness and stress reduction habits. Now, recovery techniques are strategies which we use when you are already into the mode of burnout. So, what we do, we take time off and rest. You can take the vacation, you get proper sleep, you start assessing whether this much work is required or not, and you can start delegating the work. You talk to your supervisor and professors about reduction of the workload, and you let go of your thinking of perfectionism. And sometimes if it is required, you take professional help also, like in very higher institutes like IITs, MITs and other institutes. Now they have institute counseling service which hire professional clinical psychologists as counselors, and they help you in that regard. In the professional settings and work settings also, they have tie up with the professionals. Now, how to foster a supportive environment to reduce stress exhaustion. So, now we have to combine the system and we have to combine the personal well-being to make a very good supportive system. Open communication is required, and institutional and managerial support is also required. There should be flexibility and autonomy, and there should be access to mental health resources. Now I am telling you how you do it. Open communication gives you a sense of accomplishment so that you can convey your needs to the to other and higher authorities, to your professors, so that it will lead to a better mental health. Second thing is managerial support. Support from the topmost hierarchy is very much required, because despite that it's very difficult for the institute, for the student and employee to practice assertiveness and take proper rest and be mindful. The third thing is flexibility and autonomy. There should not be micromanagement so that people feel helpless. They should know that they can have some options, like they can go into the hybrid mode if his health is not allowing. Sometimes the deadlines can also be flexible. Access to mental health resources is very important. So now the take home points are that you have to recognize that this is the loop of burnout and I am going into it. So you just stop yourself. You take proper care, self-care, which is a very requirement. You should exercise mindfulness based techniques. You should set timely goals. You spend some quality time with your family, that is very important. And the extra work, overwork should not be normalized. That it is not very good that you are spending too much time in your lab, your classroom. The efficiency should be promoted. So burnout is not a personal failure, it's a human response to prolonged stress in unsupportive life conditions. Now these are the resources which you will go through, and definitely this will help you. Thank you so much for giving your patient listening.